Good morning, everyone. We're going to start in a minute just to allow people to join in.
Can we see if everyone can hear us?
Sorry, can you guys hear us? Those online, can you just, thank you.
So got a thumbs up.
Thanks.
Okay,
Yes,
people can hear
yes.
us.
Thanks,
Great.
thanks, thanks.
And is my screen presenting?
Can you see the screen as well? Awesome.
Okay,
Beautiful.
thank you.
Yeah, okay, we're about to start, but before we start, just want to set out some house rules. Please make sure that you mute yourselves. Otherwise, Benny, if you hear any background noise, please do mute people. And questions will be allowed at the end of the presentation. So you can type your questions in the chat box, or you can just raise up your hand. Then we'll allow you to ask your questions. So let me just introduce our topic and our speaker today. Our Cochrane webinar today is on exploring clinical trials in the Cochrane Library. And we have our speaker, Mr. Amir Hofeld. He's a senior scientist. Sorry?
I'm just saying hello.
Oh, okay. Amir is a senior scientist in the Cochrane South African unit. He's also the coordinator of Cochrane Africa. He's currently pursuing his PhD in epidemiology and biostatistics at Stellenbosch University. His interests include evidence-based healthcare, evidence synthesis, and improving trial conduct, explicitly focusing on ethical practices linked to transparency and reporting. His work as a research methodologist primarily focuses on conducting evidence synthesis and supporting guideline development work in South Africa and internationally, including work with the World Health Organization. Amir, take us away, please. Thank you.
Thanks, Annalisa. Thanks everyone for attending. We're happy to be here and to share some tips and tricks, I guess, pertaining to Cochrane Library. So just to mention, I'm by no means, I guess, to say an expert, and if others have some tips to share during the presentation, please, add some comments to the chat, or we can also discuss once we have a bit of a Q&A bit after the presentation. So I'm happy to hear your thoughts. Okay, so for today, we're exploring clinical trials, the clinical trials section, I guess, within Cochrane Library. And so this is typically known as Central or Cochrane Central Register of Controlled Trials. I'm going to go over a few summaries of concepts that we've covered in the past and that you probably know well by now. But it's just to give us a bit of a understanding and on the position where we coming from for this particular presentation. So as we know, with the steps of a Cochrane review, the broad steps, I guess, or with any very well conducted systematic review, we generally start off with phrasing a question. We have a question in mind, present it, and then we identify the PICO, the mnemonic linked to it. We develop a search strategy, select appropriate databases, and perform a search as part of the the first part of the actual review process. And then, as you can see over here, highlighted as number 4. This is particularly the area that we'll be focusing on today. As we know, planning the search is important, helps us to locate relevant information, conduct an effective and comprehensive search, and we want it to be we want others to replicate it, verify, and we also want to report on the search. So we want to be as transparent as possible. again, just a bit of a summary with electronic databases. We've got these general ones that we have listed over here. So it's Cochrane Library, specifically Central, that you can see in italics. And then we have the regulars, PubMed, Embase, Web of Science, and Scopus that we would normally search. And then there are also, to name a few, the specialists databases that's in the blue box at the bottom. This is something that we do not want to forget, and those are the unpublished studies. So these would be studies that are either ongoing studies that we'll find in child registries, or also potential unpublished studies that we may even find were presented as theses. Publication bias as a whole, as we know, is important, and so we want to kind of reduce it through our planning of our searching when it comes to the Cochrane Library or any other database that we're looking at. And so we know that registering trials in advance helps to ensure that both positive and negative results are available, and not just studies with favorable outcomes that we may likely find. And then we also want to promote transparency, accountability, improve our research integrity, and this is important, especially, and that's why we want registration of trials. And it also helps us to facilitate and identify, like I said, ongoing and potentially unpublished studies. So trials that are registered or that are that heading should probably be changed, but registered in Central or found in Central, like I said, they would be planned, ongoing, or completed studies, and these would usually be what we call our randomized control trials or quasi-randomized trials. Also to note that we don't want to forget the other trial registries like clinicaltrials.gov, WHO, PACTA, and the EU clinical trial registers, to name a few. So when you're going to the Cochrane Library, and I'll show this live after the presentation, but just to avoid any switching of screens, etc., I thought this would be simpler, just taking out some screenshots for this portion of the presentation. You will come to Cochrane Library, and you'll see on the top there are a couple of tabs with a couple of headings of Cochrane reviews, and then searching for trials. This in particular is quite useful. So it tells you, as you can see, the first subheading, what's new. So it will give you monthly updates on how many trials were added to Central, and any other interesting news or tips that can serve as guidance. And then you also have your regular help options, search help for quick guides, and your frequently asked questions. The last three are subheadings that I'll look at or particularly focus on for part of this presentation. So looking at Central itself and what is Central, you will see that Central is really, if you were to click on it, this is what you'd see on the website. That Central is a rich database of bibliographic reports of randomized trials, and basically you can search Central for high quality evidence from many trusted sources, and these help you to find the best available evidence to answer your questions quicker. So what does Central really include? So it's made up of more than 2 million bibliographic records, which include the author, sources, and the year. And many of these records include an abstract, but they do not contain full text of the articles. Like I said, it's created from many trusted sources. Most of them come from bibliographic databases like PubMed, Embase. They also come from published and unpublished sources like CINAHL, clinicaltrials.gov, and WHO ICTRP, or what is called WHO's International Clinical Trial Registry Platform. and this is irrespective of language or of date of publication. Something that one also may ask is, well, also, how is Central essentially created? So the Cochrane Central Register of Control Trials Central contains, like I said, the RCTs and quasi-RCTs, and these are records that are identified by Cochrane Central Search Service and other sources. And you can see those are hyperlinked texts, which you can go on and read more about. Central is published monthly, like I said, with new issues published on the last day of each month. Something I do encourage is also looking at the centralized search services. And here you can find a combination of application program interfaces, which directly feeds into it. And there's also highly search sensitive searches, machine learning and crowdsourcing that is used. Crowdsourcing is particularly quite interesting. And this is where you can actually volunteer to identify RCTs and quasi-RCTs. So you can actually sign up and request to assist with that. Then something quite important, and that is looking at retracted publications in Central. They got quite a extensive page, but I'm going to summarize it. So part of what Cochrane's policy is to exclude retracted studies from its reviews. But identifying retracted publications can be quite challenging, especially if the retractions occur during or after the review process. So basically, to improve transparency and trustworthiness, Cochrane is working on or working to label retracted RCTs records in Central, and then also identifying link retraction notices to the original records, and also update Central records to clearly indicate restrictions. There are also further questions that one may ask, and this you can see in the bottom box over here with the blue headings. Some of them all of them we will touch onto, but you can see with the first question what one may ask is, so does my central search contain retracted publications? And so all of these do have hyperlinks, and this is one way of answering it, which Cochrane provides a means to addressing. So you can add the following text. I just want to put on my layers over here. So as you can see, one can add that as a search term in order to find or identify retracted publications. So here there's an example where it's possible that the PICO, part of the PICO, the population was people that have tinnitus, and maybe they're trying to manage it with zinc as the intervention. So as you can see, they've done a very simple search where they've included 1 and 2. And then they also added this retracted publication as a line in line 4. So then they've added 3 and 4 together to then find out whether there are any trials that have been retracted on this particular topic. Just to give a bit of an example over here, take off that laser. So what I did is I went into Central, and I basically did that search, right? And as you can see, if one simply had to look at just tinnitus and zinc together in line 3, you'll find 15 studies on it. But if you had to look at line 5, where they added the retraction of the publication, you actually find that there are no retractions, which is a good thing. And so if one had to click on it, you would see that your Cochrane reviews and your trials, it all has 0 across, meaning that there's likely no retraction on this particular topic. Another question one may ask is, so do my exported results from Central include retracted publications? If we had to find out how to approach that, there are two options in doing so. So you can export all your results in one file, and then any retracted publications within an export file would be then would have the publication type PT value retracted publication, so it will be identified. Or you can also export retracted publications in a separate file. And here they basically explain how to do it, and again provide you with a nice example of addressing this. One may also ask that actually I want to identify other retractions related materials in Central. So how do I go about doing that? So yeah, they give you a nice bit of an explanation. So they say, although a journal may retract a publication, the communication of that retraction is often incomplete, both in the use of vague retraction notices with euphemistic language and the inconsistent and ineffective annotations of retracted publications. And so then they then have developed a search string where you can consider these following terms, and these are the terms that they've included. And nice of them, they've also included a link. So if you press on that link, it then shoots out basically this over here. And as you can see within Cochrane Library, there are 3,600, 3,065 retractions. So one would have to see, okay, well, how many of them are trials and possibly other forms of studies. So that's something quite interesting when looking at Central. What I'm going to do now is use also a bit of a case scenario. We've probably covered this multiple times in the past, or you've at least heard of this particular one in various lectures and talks. But it's just to have something a bit more applicable for us for today's presentation. So you have this case scenario where a member of parliament with cancer is considering legalizing or pushing maybe a bill forward for legalizing cannabis for medical use. And we as systematic reviewers are tasked by the ministry to find information on cannabinoids for nausea and vomiting in adults with cancer receiving chemotherapy. So let us identify the PICO for this scenario. It would be interesting to, if you want to, you can unmute or add in the chat what the participants would be for this particular scenario, the intervention, comparison, and outcome. So if you want to unmute or add to the chat, please go for it. Okay, so Devin, Peter, thank you. I'm assuming that would be the participants, would be cancer patients. Anyone for the intervention? Was there anything else on participants that you may want to add? Cannabinoids, okay. So would cannabinoids be part of your participant or intervention? Intervention, great. Thanks, Helen. There's just one thing that was missing over there. So under participants, it will be adults with cancer receiving chemo. So the chemo bit is what we'd want to add to the participant bit. And then intervention, like we said, cannabinoids, comparisons would be other anti-nausea medications or placebos or standard of care, etc. And then the outcome would be the absence of nausea and vomiting. So these would be general the concepts that we start off with, right? Then we want to turn these concepts into search terms. So if we looked at participants, so we have adults with cancer receiving chemotherapy. What are some of the, just for this example, search terms that we would want to include over here? So nausea, vomiting would be an outcome in this case. What are some of the terms that we'd want to include over here? Chemotherapy patients, okay. That can be part of it, yes. Cancer, yeah. Are there other ways of expressing cancer? What are other terms that are normally linked to the term cancer? Neoplasms, right? And for cannabinoids, can we think of other terms for cannabinoids? Malignancy, that's a good term for, I'm assuming that's for participants. If we move over to the intervention bit, so other terms for cannabinoids, cannabis, good. Anything else that comes to mind? Is that okay? All right. We also have the term hashish coming through. And then there's also slightly, okay, THC, CBD, okay, great. And then there's also medical marijuana that one would just consider. Okay, so that's just to get your mind into the game of what we're going to be presenting. All right. I'll expand on this particular slide a bit once in the presentation, but as you can see over here, I looked at what the mesh terms are. So these are also things that we need to always consider. And you would know from PubMed. PubMed also has this thing called mesh terms, which are medical terms or medical search headings. So if one had to put the term cancer, like for the participants, in the search bar, as you can see over here, it's not too clear, but as you can see over there, then it would basically, it changes it up and it searches for neoplasm. So you'd say look up, and then that you'll find the exact search term neoplasm and the phrases as well. You then go over to the mesh trees and you have the possibility or the option to explode all trees or have a single mesh term. We usually explode all trees. And the reason for this is that it means that your search will then include the term neoplasms plus all more specific terms that are, fall under this mesh hierarchy. So these could also include, for example, breast neoplasms, lung neoplasms, etc. From this point on, you can then add it to your search manager, and then it becomes part of your a search term that you can add to your search string. Similarly, we did this with cannabinoids. So I added the term cannabinoids under the mesh bit. Press look up, and you then find this thesaurus of matches again. So this is just it's just purely for example and for the this presentation. A study like this or a review like this would consist of probably a bit more of a comprehensive search. But as you can see over here, we conducted the search. We added the term cancer, neoplasm as a mesh, tumor, etc. And then we built it up basically. So we've started off with the participants, terms for the participants, and then terms for the interventions, all separated by or. And then in line 11, you can see we added 5 and 10, and we then got 396 studies. And then I added the retraction bit that or string that I spoke about prior to this. So I added all of those terms, and then as you can see, I used my final search from number 11, and then also added number 18, which is basically the string for retracted publications. And fortunately, there are no retracted studies linked to cancer and cannabinoids. So that brings me to the end of this portion of the presentation. What I'm going to do now is I'm going to show you do some live demonstration. I'll just get my screens in order. And maybe just tell me if you can see the news screen that is popped up. Yeah, I get a couple of thumbs. Great. So if you were to type in cochranelibrary.com, you would land on this page over here. And like I showed you earlier, it will give you all the various options. Want to make sure I'm a human, I think. Let's see. There it goes. Okay, so and like I said, you have all your hyperlinks and all those things that will take you to the various resources. Always important, if you're a first-time user of Cochrane or you've used it in the past but you don't have a profile, please do set up a profile. It is free, and you can then sign in. So as you can see, I signed into the Cochrane Library, so it has my name registered. Then what you can do is go into the advanced search, and then it starts off basically with a more simpler means of searching, as you can see in this bar over here. But you can also go into Search Manager, and as you can see, it's kept my search of the case scenario that we looked at. And you also have your mesh terms that you can look up. So, for example, like I said earlier, if you had to type in cancer over there and look it up, press that, look it up. It then gives you that as an output, right? And so you can see that there are trials with the cancer as a mesh term in, is that 127,000 some odd trials, and Cochrane reviews there are 922. Gonna go back to the search manager, and as you can see over here in line 11, which would be my actual search for this particular example, there are 396 studies. If you click on it, you can see that there are 47 reviews out there that this search retrieves. There are Cochrane protocols, of which there are 10, and then trials 337. Let's just go to the Cochrane reviews and see whether we can find a Cochrane review that looks at people with cancer on chemotherapy that take cannabinoids for nausea and vomiting. So let's just see. I don't see any at the moment. Okay, number 14. So as you can see, number 14, cannabinoids for nausea, vomiting in adults with cancer receiving chemotherapy. So that would, for example, be a review that was conducted, but it was conducted in 2015. So it's quite an old review. Maybe someone would want to update that review and see whether there's newer evidence or new evidence to add to it. If that would be the case, you would then go to your trials and see, okay, so what trials are there on this particular topic? And then you are then able to scroll down and review them. And so you can then select them and export them to whatever screening software it is, whether it's Rayan or Covidence, etc. You also have filters on the side, so you can see the year of publications. Also nice, what one can do is see the sources. So there are 64 studies that have been tagged from clinicaltrials.gov, and from ICTRP there are 38. So as you can see over here, sorry for scrolling, but at the end of the citation, you can see that it says, it's found this particular study number 1 in PubMed and Embase. Let's just have a look and see if we can find any that have come out of a trial register. So number 8, for example, has clinicaltrials.gov as a label or tag. There's another one, number 14. Others are all PubMed and Embase. But maybe the other bottom links over here, these hyperlinks at the bottom, will also have the ICTRP tags as well. Next bit that I also want to show you is that once you've developed your search strategy and you finalize it, you're happy with it, you can also save it. So for example, over here, I've saved this one as my cannabinoids example, and I said with retractions because I added this retraction bit to the end. So you can actually save it, save as, and then give it a title, and also give it a bit of a description. So when you are conducting a systematic review, you don't have to redo the process every time, but you can actually just go to it. Like for example, over here, where I've got a whole list of reviews that I've either conducted in the past or am conducting currently, and I can then run the search. So for example, let's just see what there is over here. There was another review that we were looking at recently, which were SMS notifications. Okay, there are a couple of errors over there. Haven't looked at that in a couple of weeks, but you are able to, okay, we can also do this. So there's an African filter that I sometimes use, and you can simply just recall it, and it will then show up on your screen. So you don't actually have to go and manually put it in every time. So those are just some of the workings of Central that I've got for you today. Annalisa, I'm happy to start taking questions, and if there were any responses in the chat, I don't see any new ones.
Thank you so
But
much.
yeah,
Thank you so
thanks.
much, Amir. Thank you for a great presentation. I didn't see any questions in the chat box, but I'm happy to take questions from the audience. So you can just put up your hand, then we'll allow you to ask Amir any question. Thank you.
I'm so happy to hear any tips and tricks
And
from
yeah,
others that maybe I haven't covered, and maybe I can cover the next time around, or maybe
or any
people may want to
comments.
present. Yeah, go for it.
Okay, it's just a comment. Yeah, from Helen, also from Peter. Thanks, very informative session. Thank you so much.
It would be interesting to hear
Okay.
if others have used
There's
that
Nitha.
retracted.
There's
Okay, okay.
Nitha. Hi, Nitha. Go for it.
Hi, so thanks very much. I mean, learned a lot and have not used in that way. So my question is, with the recent in HIV prevention and clinical trials, a lot of articles have been retracted because of the population description.
Okay.
And so how, because the science of that is critical, but they may have been retracted because of the political landscape. Is that being looked at in the Cochrane Library in any way? And if yes, how? And if not, what are the plans?
So are these studies or trials that were conducted, and were they then published and then retracted thereafter after publication?
Yes, that's a possible scenario.
Yeah. Or
Possible scenario. Sorry, my mute is gone. So there are different scenarios. Some journals have taken a stance, and because you focused quite a bit on retraction, which is interesting for me,
yeah.
and that it is important that we understand the retraction. That's my take-home message from the discussion.
Yeah. Yeah. So I mean, from my understanding is that anything that was initially published and then retracted, or whether, like I said on one of the slides, there's some euphemistic language to indicate that there is a retraction, then, if it hasn't already been labeled as retracted in by Cochrane or by Central, then it's probably will be eventually. Yeah, so I think that's just generally is the stance. I think probably one
Thank
would
you.
have to do a bit of a testing and develop a an example, or trial Pico, I guess, and actually see whether that search string identifies retractions that you yourself know of, or so if there are studies or trials that that have definitely been retracted, test it out and see if it picks it up. If not, then I think it would also be worthwhile reaching out to Cochrane, like I said, through those links, and bringing it to their attention, because maybe there's some tweaking that also has to be done on their side.
Thank you.
Thanks, but that's a very important and important question that you pose.
Thank you so much, Amir and Nitha, for that discussion point. Yes, okay. Any other comment? I see Karina apologizes for joining late, so please do share the recording with her. We've noted that down, Karina.
Also to note, I think most people know, but we've also got a YouTube channel. And I
Yes,
think
yes,
maybe
yes.
Lorenzo will add the
We'll share
link
the
to the
link.
chat.
Sure. Okay.
We I'll sound like a YouTuber, but please like and subscribe. You'll get your updates. But there are also multiple other previous recordings throughout the years, which are quite interesting as well. And so we are trying to build, through these webinar series, build a nice library where people can practically also follow and see these tips and tricks.
Amir, you do indeed sound like a YouTuber. But yeah, he's right. We've got a YouTube channel. Benny, don't forget to share the link so that people can just go through even, the previous webinars and not just this one. All right, if there are no more questions, oh, Nitha.
Sorry, yeah, so this is moving forward. I mean, even for me, clinical trials is evolving. And one of the new things in terms of clinical trials, because of cost, etc., and again, very much focused on HIV-related work, is the type of designs that have evolved and changed. And so the terminology or the search strings would evolve as well. So it's not just RCTs any longer, especially in the HIV prevention field, because of the nature of now having products, for example, that prevent HIV infection. So that's a nuance and a new aspect to consider within the Cochrane library, because it's new language in terms of designs, cofactor, et cetera, et cetera. And then the last comment I wanted to make is that, well, I work with MRC, interestingly, but I'm not familiar with the fact that you have YouTube. So is it the branding thing that have I missed? I've used the Cochrane a little bit, or is it something that we need to promote more in the organization so that it can be shareable outside SMRC? That's just a comment. Thank you.
Thank you,
Yeah.
Nitha.
Thanks. I think the first bit on I guess the evolution of trials and methods and terminology, that's important, and I think it's something worthwhile to all of us just to look up within the Cochrane handbook on those type of matters regarding terminology. Regarding the YouTube, I think it's yeah, maybe we should do more about promoting our YouTube channel. But it's a good point. We normally just talk about our YouTube channel through these webinars and hope that it spreads, I guess, word of mouth. But yeah, something for us to look into. Thanks.
All right, thanks, Amir. Any other comments? Maybe one last comment, otherwise we can adjourn the meeting if there's no comment. Thanks so much, Amir, for your time and for presenting to us. Is there any? Sorry, Amir?
I think maybe just to end off with, if people have topics or things of interest that they'd like us to cover, then please email any of us, and we'll be happy to develop a session to cater to whatever needs it is that you have.
Perfect.
Thanks. Sorry, Annalise,
Sure.
I cut you off, but thanks.
No, it's fine. Thanks a lot, Amir, and thanks everyone for attending. Look out for, prospective webinars around the Cochrane Library. There's one coming up in August on overview of systematic reviews and how to search the Cochrane Library for systematic reviews. Okay, thanks so much, and
Okay,
have a
thanks everyone.
great day ahead. Goodbye.
And a nice weekend. Bye. Stay safe. Bye.
Thank you.